Hi, my name is Dr. Ryland Gore. I am a breast surgical oncologist, and the object I use the most to make clinical decisions is mammograms.
Can you describe your object?
So every single day, I need to use mammograms to make clinical decisions. Every single patient that comes to me has a mammogram. They might have other breast imaging like an ultrasound or an MRI, but the mammogram is the building block of what I do. It allows me to see what's going on in the breast, and it allows me to make decisions for the patients regarding what they need regarding surgery.
For those unfamiliar, can you explain what a breast oncologist does?
So I'm a breast surgical oncologist, meaning in layman's terms, I'm a breast cancer surgeon. I take care of patients who have malignant breast disease, so breast cancers, but also patients who have other breast issues that need a surgeon's expertise.
How does the object aid in the day-to-day tasks in your industry?
It's absolutely necessary. I cannot give my clinical opinion without having some kind of imaging, whether it's the mammogram, ultrasound, whatever. But the mammogram is the building block. That's what I use for every single patient. If you come into my office with a complaint, then that's the first thing I'm going to want.
What is the difference between benign and malignant breast disease?
Benign is just a tumor, a growth. It's not going to cause the patient any problem in the future. It's not going to turn into something else. It's just a nuisance. Malignant, that means it's cancer. It's a problem. We need to get it out.
Can you share a memory attached to your object?
So my earliest memory in medical school at Morehouse School of Medicine, I'm in breast clinic and we're looking at these and I was like, what is going on? I don't need this in the future. So the fact that I have to look at these every single day is pretty ironic. I did not think that I was going to go into breast care when I decided that I wanted to be a surgeon. So it's a full circle moment.
Do you have any advice for families who want to support a member with breast cancer?
Every day is different. Be there. Sometimes on the day to day, the patient doesn't even know what they need. So provide support, listen, try to anticipate their needs, whether it's getting groceries, whether it's just sitting there with them and providing company, going to doctor's appointments and being the second set of ears to write notes, being the one to fill in the gap for the patient. They'll let you know what they need, but I think being anticipatory and also showing up for them. So many of my breast cancer patients complain about the fact that people they thought would be there are not there. People they thought would call didn't call. Even if they don't answer the phone, call anyway, text anyway, and say, I'm there for you. I think that's what they need the most.
And last question, what can our audience do to catch any potential signs early?
I always tell every single patient, every time I do a talk, if you feel something, say something. I find that a lot of people just kind of go through life hoping it'll just go away. It's not really a thing. Pay attention to your breast, know what they feel like. And this goes for the men too, because for some reason men think they can't get breast cancer and they absolutely can. Men make up 1% of breast cancer cases. So if you feel something, say something. If you notice any changes, whether it's changes to the nipple discharge, a new lump, not just in the breast, but underneath the armpit, that could be a sign that there's cancer in the lymph nodes. Any redness, any dimpling, any new swelling, especially if one breast is larger than the other. These are red flag signs that you have to pay attention to and not sweep underneath the rug.